Certainly. I wonder, Dr. Wright, if I could come to you. So, as I understand it, in the Mental Health Act, there's a distinction between people who are mentally disordered and who are mentally ill. And so, do you have any information from the inquiries you've been making in Cumberland whether the persons who absconded from that hospital were mentally ill or mentally disordered?
I should have said at the outset, Ms Carter, we're specifically not investigating those two incidents because they are going to be closely investigated by a number of other inquiries, and we are looking at the systems. I can elaborate on the differences with those types of.
But isn't there a systems issue in relation to being able to find, and the role of the police if someone is mentally disordered or mentally ill?
Well, we can examine the systems without looking at those particular cases.
And are you examining that issue and the
yes,
interaction with the Mental Health Act?
Yes, we are.
Okay.
And so very, very specifically what we have already started conversations about is what is the process in the event that someone doesn't return from leave or absconds.
Mm-hmm. What do you understand to be the process with a person who is mentally disordered?
With a person who's mentally disordered?
So if a person is mentally disordered, what is the requirement in the Mental Health Act?
So the process is far wider than how someone is managed under the Act, because I need to be very clear.
No, but I'm asking specifically about the Act.
It's not determined by their status under the Act.
Is there a different requirement in terms of medical checks if somebody is mentally disordered and mentally ill under the Act?
No, there isn't. The difference.
So there's no requirement for a 24-hour check for somebody who is mentally disordered, but there is for mentally ill.
Excuse me, Chair. This is a really complex area.
Can
we
you let
allow
him finish
Dr.
the
Wright
question?
to finish?
Well, I've actually got a very specific question, and I don't know that Dr. Wright is engaging with the question, which is why I'm trying to be more specific about it.
What is this?
Well, the question
is...
I'm asking, what is the requirement under the Mental Health Act for regular medical checks for someone who's mentally disordered? Is that different to somebody who's mentally ill?
You were right. So we're not talking about absconding. We're talking about
under the Act. No, we're talking about the way the Act works, yes.
Yeah. So if someone is mentally disordered, there is a requirement that they be reviewed every 24 hours. And
if that patient is not available to be reviewed every 24 hours, what happens then?
That's if they're not able to be. So anyone who's as a mentally disordered person needs to be released or within 3 working days anyway. But if someone is not available to be reviewed, that could only be the case if they have absconded. Then what happens is that there is a specific risk assessment of that individual and their circumstances and a determination of what action to take.
And what are the available actions that can be taken?
Starting with ringing the person and say, please come back, because we often have contact details and they have they have phones, escalating to contacting the next of kin, to contacting the community mental health service or other practitioners involved in that person's care, and in the event that there is a concern about the safety of that person or someone in the community, contacting the police.
And what are the factors that would trigger a concern about safety to that person or to other people in the community?
The best guide of safety. So we can't predict the future.
No,
I'm sure you know that.
Yes.
Yes. But the best guide to assessing the level of risk is past behaviour. And so if someone has a history of either harm to themselves or serious harm to others, then that would be a major cause for concern. There would still be attempts to contact them and have them return through all the lower level strategies that I talked about, but that would probably include also contacting the police.
So if a person is mentally disordered and they are, it's the morning of day 3 and they abscond, what sort of efforts are engaged in to encourage them to return?
It would be the same. If someone leaves before it's our intention for them to leave, we would go through the same process.
And to engage the police, what is necessary to be able to engage the police to ask them to locate, detain and return a person?
We need to be satisfied that there is a significant risk of harm either to the person who's absconded or to the broader community.
And so if you don't believe that there is a significant risk of harm, the police are not engaged?
That, in my opinion, is the appropriate practice. Part of our conversations with Cumberland and the management there is to understand their precise procedures, because not all facilities across the state have precisely the same procedures.
Why is that?
Because they're all individual services, and they have their own. I mean, we've got policy, but there are individual procedures with the districts, and sometimes.
So in what ways would if we're talking about mentally ill people, we're talking about the same legislation. We're talking about New South Wales Health. How different are the procedures from facility to facility?
The process that I described to you is not in the legislation.
So that's the process you would hope, but you're saying it may not be in place at every mental health facility in New South Wales.
That's correct. Yes.
And is anybody doing any work to ascertain exactly the processes in place at each of the different mental health facilities?
Well, I think in answer to an earlier question, I talked about the fact that we've got representatives from several different districts, and one of the advantages in that is that when this conversation came up, because it has already come up, we were able to discuss, immediately compare what happens in the different services, and it's also a matter, quite an important matter, between the leadership of the local district and the local police, because we need to be clear of when we are asking the police to be involved, that there's a sufficient level of risk to justify that, and to have the kind of relationship that we can work effectively to try and locate people.
So I think the figure the Minister gave us this morning was that there were 191 instances of a patient in a mental facility absconding during the last calendar year. If we've got roughly 4 people a week absconding from mental facilities, why hasn't this conversation come up before about what the procedures are when somebody absconds?
The conversations probably come up at a local level all the time, and I think that the concept of a risk assessment of the need to involve police to find someone or help us find someone who has absconded. That's been a conversation that we've been having with police, particularly in relation to the discussions around the Memorandum of Understanding over the last several years. So the conversations have come up, but there are times when, and this is why we take incident investigation seriously at every level. We work in very complex systems, and the staff working in those systems have many, many difficult decisions to make every day. On
notice, are you able to provide us with the list per LHD of how many people absconded each week per LHD over the last calendar year?
I can give the figures. I don't know if it's each week. We've certainly got we certainly do have the figures for by location of the abscondings over the course of the year.
Could you also add for so far